Welcome to this explainer. I am so incredibly thrilled to guide you through today's topic. We're diving deep into a really comprehensive journey to fully unpack Polycystic Ovary Syndrome, or PCOS. Whether you're a healthcare student, a patient yourself, or just someone truly passionate about women's health, this explainer is built to peel back the layers of a condition that affects literally millions of people, yet somehow remains incredibly misunderstood. We're going to be leaning directly on the absolute latest international evidence-based medical guidelines to break all this down. So get comfortable and let's jump right in.
13%. Up to 13% of women of reproductive age are affected by PCOS. Think about that scale for a second. That's a massive number. It makes it one of the absolute most common endocrine disorders worldwide. We are not talking about some rare anomaly here. We're talking about a major public health reality. Millions of individuals are navigating this condition every single day.
But that brings us to a really staggering paradox. If it's so incredibly common, why do so many remain undiagnosed? Why are so many people just slipping right through the cracks of the healthcare system? To figure that out, we have to shift our focus from the sheer scale of the issue and look closely at the invisible, systemic complexities of the condition itself.
And that has to start with a solid definition. PCOS is a common, lifelong endocrine disorder. It affects ovarian function, hormonal balance, metabolism, and long-term health. Now, did you notice what's missing from that definition? It doesn't just say a reproductive issue. It's a complex metabolic and endocrine condition that impacts the entire body. And honestly, that is exactly why it can be so tricky to identify if you're only looking at one tiny piece of the puzzle.
Okay, here's our roadmap for today. First, demystifying polycystic ovary syndrome. 2, symptoms and hidden causes. 3, the path to diagnosis. 4, comprehensive treatment and management. 5, real patients, real outcomes. And finally, 6, myths, facts, and the future. Let's do this.
Section 1. Demystifying Polycystic Ovary Syndrome, the hidden mechanisms. To truly grasp where we are today, we need to trace how our understanding of this condition has evolved. Back in 1935, this was known as Stein-Leventhal syndrome. And frankly, our understanding was pretty limited. Fast forward to the 1980s, and huge advances in ultrasound imaging gave us a brand new way to look at the ovaries. By the 1990s, the medical community began to unlock the modern understanding of insulin resistance, finally linking those reproductive symptoms to metabolic health. And that brings us to 2023, where we now have highly comprehensive, international, evidence-based guidelines driving precision medicine. We've honestly come a long way.
When we contrast a standard menstrual cycle with a PCOS cycle, the disruption becomes crystal clear. Normally, a cycle is driven by regular rhythmic hormonal fluctuations. Estrogen, progesterone, LH, FSH, they all work in perfect harmony to trigger ovulation. But with PCOS, that cycle gets disrupted, often by hyperinsulinemia and increased androgen production. This creates a hormonal imbalance that leads to what's called follicular arrest. Basically, the follicles just don't develop properly, and ultimately, that leads to a failure of ovulation. It's like a finely tuned symphony that's suddenly playing out of sync.
Section 2. Symptoms and hidden causes. Bringing it to the surface.
So, how do these internal microscopic mechanisms actually manifest for patients in the real world? Well, primarily through reproductive and menstrual symptoms. Because of that failure to ovulate we just talked about, women often experience irregular, infrequent, or sometimes completely absent periods, and occasionally really heavy menstrual bleeding. Plus, the excess androgens, those male-type hormones, manifest physically. This causes hirsutism, which is excess facial and body hair, along with stubborn acne, oily skin, and unfortunately for many, a really tough time conceiving.
But remember what we established earlier. PCOS is far from just a fertility issue. The metabolic and mental health impacts are severe. We're talking about weight gain, immense difficulty losing weight because of that underlying insulin resistance, and a very real risk of prediabetes. We also see sleep disturbances, significant anxiety and depression, and physical markers of insulin resistance like acanthosis nigricans, which are those darkened patches of skin. It is truly a systemic syndrome, which means it requires systemic care.
Section 3. The path to diagnosis. Mapping the criteria.
With such a massive, varied spectrum of symptoms, how do doctors actually pin it down? They confirm a diagnosis using the gold standard, the Rotterdam criteria. Step 1, irregular or absent ovulation. Step 2, clinical or biochemical signs of hyperandrogenism. So things like the excess hair we mentioned, or elevated testosterone showing up on a blood test. Step 3, polycystic ovarian morphology seen on an ultrasound.
Now here is the absolute crucial point. After excluding other causes, a patient only needs 2 of these 3 features for a diagnosis. You absolutely do not need all 3.
And you know what? I want to take a quick second to debunk a major point of confusion right here. The cysts seen on a PCOS ultrasound, they are actually immature follicles stuck in development. They are not true ovarian cysts in the traditional sense. Honestly, the name Polycystic Ovary Syndrome is a bit of a historical misnomer, which is exactly why understanding that underlying follicular arrest is so incredibly important.
Section 4. Comprehensive Treatment and Management, the Toolkit.
Shifting gears from identifying the problem to empowering the patient, we can see that treatment relies on 3 main pillars. It completely proves that a multidisciplinary approach is absolutely essential. The first pillar is lifestyle therapy. This means tailored nutrition, aerobic and resistance exercise, and for those who are overweight, even a modest 5 to 10% weight loss can dramatically, and I mean dramatically, improve ovulation and metabolic health. The second pillar is medications, and the third covers fertility and surgery, utilizing tools like ovulation induction, IVF, or in very select cases, laparoscopic ovarian drilling. The takeaway? Care has to be highly individualized based on exactly what the patient wants to achieve.
To really illustrate that individualization, let's compare 2 super common medications. Metformin is used primarily to target the metabolic side. It improves insulin resistance, lowers blood sugar, and acts as a shield for long-term metabolic health. On the flip side, combined oral contraceptives are often prescribed to target the reproductive and hormonal side. They regulate menstrual cycles and manage that hyperandrogenism, so they help clear up the acne and excess hair. Doctors can mix and match these tools directly to the patient's immediate needs and their personal life goals.
Section 5. Real patients, real outcomes, grounding the science.
Let's ground all this clinical data in the real-world experiences of patients across different life stages, because it looks different for everyone. A 17-year-old might focus heavily on managing irregular periods and acne through lifestyle interventions and really specific medical care. Meanwhile, a 28-year-old might be teaming up with a physiotherapist and a dietitian to tackle metabolic health and insulin resistance. Then you have a 32-year-old facing anovulatory infertility, who successfully conceives using targeted ovulation induction, and a 40-year-old might be super focused on diligent metabolic monitoring to prevent type 2 diabetes and fatty liver disease. Yes, PCOS is a lifelong companion, but proactive, tailored management absolutely works.
Section 6. Myths, Facts, and the Future. Clearing the air.
Before we look to the future, we have got to address the rampant misinformation out there. The first and perhaps most devastating myth patients here is that PCOS always causes infertility. The sheer fact backed by hard evidence is that many women conceive successfully. Some do it naturally through lifestyle modifications that restore their ovulation, while others hit their goals with individualized fertility care. This brilliantly illustrates that a PCOS diagnosis might be a hurdle, but it is definitely not a definitive barrier to starting a family.
Here is another incredibly common and frankly harmful myth: the idea that only overweight women develop PCOS. The absolute fact is that PCOS affects women of all body types, all weights, and all ethnicities. Lean women with PCOS still battle insulin resistance, they still have hormonal imbalances, and they face the exact same risks for long-term complications. Assuming this is just a weight issue delays crucial diagnoses for so many women.
And finally, the diet myth. If you spend 5 minutes online, you will see a million influencers selling a single, magical PCOS diet that promises a total cure. Well, fact check. There is no magic diet. Nutrition must be highly individualized to the patient's unique lifestyle and culture. Having said that, guidelines often do recommend a Mediterranean-style eating pattern, so high in fiber, lean proteins, healthy fats, and low glycemic carbs, because sustainable, healthy lifestyle modifications are the true long-term goal here.
Ultimately, polycystic ovary syndrome is a lifelong endocrine condition that affects reproductive, metabolic, and emotional health. But, and this is the most important part, it is highly manageable. With early diagnosis and truly individualized care, patients can protect their long-term health and achieve an incredible quality of life. The science is evolving so fast right now, from precision medicine to brand new insulin-sensitizing therapies, making the future look incredibly bright. But this leaves us with a critical challenge to think about. If millions of people are navigating this highly treatable condition in silence right now, what step will you take today to close that gap between awareness and action? Keep learning, keep asking the hard questions, and I'll see you in the next explainer.